Living with osteoarthritis. Living with osteoarthritis. What is osteoarthritis? Osteoarthritis is the wear and tear of joints that can lead to pain, stiffness, and swelling. Most commonly in your hands, specifically at the base of the thumb, fingers, elbows, hips, and knees. This is a healthy joint. As you see here, we have a natural rubbery cushion called cartilage at the ends of our bones that act as a natural shock absorber. Repetitive movement and years of use can irritate the cartilage, causing it to break down. If enough cartilage breaks down, bone starts to rub against bone, causing pain and reducing your range of movement. Risk factors are things that make it more likely for you to develop osteoarthritis. This includes age, occupation, trauma, family history, and gender. Does your osteoarthritis keep you from doing the things you need to do or want to do? Like getting dressed in the morning, while shaving, while driving to the store, while spending time with family and friends, or while working. What can occupational therapy do for you? The goal of occupational therapy is to reduce the pain, stiffness, and swelling associated with your arthritis so that you can get back to participating in all your daily activities. Splints.
Depending on where you are experiencing pain, swelling, and functional use difficulties, an occupational therapist can provide you with an orthotic, otherwise known as a splint, to address your needs.
If you are experiencing swelling in your hands, you can use compression gloves. These will reduce swelling by helping the fluid travel back out of your hands. Sometimes, the positions you sleep in can aggravate your osteoarthritis, causing you to wake up in pain. For extra protection for your joints while you sleep, you can use a pillow splint. A pillow splint will provide comfort and prevent injury to your joints while you sleep. There are a variety of splints that can be used to properly position your thumb and wrist, in addition to providing support. Relief. In general, a thumb spica will allow you to participate in your daily activities without an increase in pain. If you have osteoarthritis in your elbow, An elbow pad can be used to protect your elbow during the day, and a pillow splint can be used at night. Joint protections.
Joint protections are strategies that you can use to put the least amount of stress on your joints during a specific activity. It's very important to protect your joints from further injury by following a set of joint protection principles that you can use while completing daily activities.
Respect your pain. If you notice an activity you're doing causes pain, stop. This is a sign that you may need to modify how you complete this activity. Use your larger and stronger joints when possible. For example, instead of using plastic grocery bags to transport groceries, use a cart or a bag with a long handle that allows you to carry it on your shoulder or forearm. This will take the stress off your small finger joints.
You're doing.
Other joint protection principles include avoiding repetitive movements such as hammering and using garden shears, avoiding activities that require prolonged
Grasp and grip. Also, it is important to balance rest and activity. It can be done by creating a to-do list of your activities and rest times.
activity modifications.
Joint protections and activity modification go hand in hand. There are a variety of tools that can be used to reduce stress on your joints and protect from further injury.
Gripper gloves can be worn to assist with opening jars. These gloves can make opening some of the most stubborn jars a breeze. They also reduce strain if you need to move a large object, such as a box being delivered to your door or moving furniture. Dicem is a thin plastic material that can also assist you with opening containers with stubborn tops, like pill bottles and bottle tops. Some additional tools that can help you complete everyday activities include utensils with soft built-up handles, key holders, and alternative zippers. A built-up handle will help keep your thumb in the most stable position while eating or preparing food. Pain management.
Using a hot pack or heat glove, your occupational therapist may elect to use a variety of physical agent modalities, otherwise known as PAMs, to reduce your pain and increase your range of motion.
Cold packs and cool water dips can be surprisingly effective at reducing pain, especially after activity or exercise. This includes fluidotherapy, which is a machine that uses heat and a sand-like material to improve active movement of your affected body part. Paraffin can be soothing and very effective at pain management. Home program. Do you experience pain when you pinch? Or does your thumb collapse? You may need to start by widening your web space. You can do this by joining both of your web spaces and holding for 15 seconds. Followed by moving your thumb away from the rest of your hand. do this, you can use a thin rubber band placed around your fingers and thumb. After placing the rubber band around your hand and thumb, slowly move your thumb away from the rest of your hand. Do this 10 times. You can also do this without a rubber band. Repeat 5 times throughout the day. First, make a fist. Then spread your fingers wide open. Then make a gentle fist again and hold for at least 30 seconds. Repeat this 5 times throughout the day. Now make a claw. This can be done by opening your hand all the way and bending your fingers until they touch where it meets your palm. It should look something like this. Hold this stretch for about 30 seconds and repeat 5 times a day. A soft ball or some Theraputty and squeeze as hard as you can for 5 seconds. Remember, this should not cause pain. Do this again for 5 times, repeating 5 times throughout the day. Self-management. Self-management is the act of making healthy lifestyle choices in order to manage your osteoarthritis. There are many healthy activities and habits you can do outside of therapy to help manage your pain. This includes massages, yoga, staying active at least 30 minutes a day, and getting enough sleep and rest. Many people with osteoarthritis have difficulty sleeping. Not getting enough sleep can make your pain worse. Setting a nightly bedtime is one way to manage your sleep schedule. Exercise in combination with your home program will help you live a purposeful life with osteoarthritis.